I was born with congenital heart defect of tetralogy of Fallot. We waited until I was 7 years old for my first surgery, and I was fine after that. I was self-regulating, so I was allowed to grow up like everybody else. Around my early 40s, I started to get these weird rhythms with my heart. Had various procedures and devices, pacemaker defibrillator with that. And then recently, all of a sudden, what I thought was just getting older was not. I was getting a little slower and walking a little slower and huffing and puffing, and it turns out that my fully corrected valve was leaking.
With Elinor being in heart failure from significant valve regurgitation, we have a lot of advanced options and therapeutics to help her. There are patients who are lucky enough to undergo an intervention that does not involve a heart surgery. Unfortunately, Elinor was not one of those people. She had to go down the pathway of surgical intervention. During the surgical intervention, we came up with a cohesive plan to address her arrhythmia needs and optimize her electrical pacing as part of her valve repair.
Elinor's electrical system was completely messed up. To fix these electrical issues, we wanted to do an all-in-one procedure and do these ablation lesions while inside her heart. We reorganized all this system so it can beat in a nice way and organized way.
There was no reason to travel far away when I had phenomenal option of Memorial Hospital with their team right here in South Florida, close to where I lived. It's what you look for as an adult congenital patient. It's rare. When you find this, you're very lucky.
What I tell people like Elinor is that when we restore circulation, they will experience living a life that they really didn't know they could live again.
It worked, and I feel great, and I'm back to exercising and doing everything I wanted to do.